Hey guys, so I just want to come on real quick and do a quick video about a recent news that I saw with a hospital in Connecticut City, yes, where two young nurses, one 19 months out of nursing school and the other one was like 2 months out of nursing school, they both lost their license. Medication error, morphine. The first one, the 19 month, I guess she was the primary nurse of the patient, and the 2 month nurse, she was the witness for the medication. When I read the article, it said that the 19 month admitted that she never stayed with the nurse to ensure that the medication was administered safely. You know, she just basically witnessed the medication and she left. And she get caught in a whole mess. Imagine leaving school just 2 months and you lost your license. It's really sad. After working 4 years, I went to nursing school for 3 years as a registered nurse, and I can only imagine losing my license after doing my degree in 3 years versus 4 years. It's heartbreaking. You don't know if you have the will or the stamina, the drive to go back through another program for another 4 years to do another degree so that you can go, you know? And I say this to say, I keep talking to our young nurses and I keep trying to motivate you guys. I keep trying to empower you guys. And I'm going to say this. If you need more time to set yourself up for success, make sure you ask this company for more time. Make sure that it is recorded that you either said, I don't feel safe in carrying out my duties and I need, because I can only imagine a nurse that is 2 months into her nursing career, still fresh. Even the nurse that is a 19 month, she's still new, still don't know much about nursing, and she lost her license. You know, that is really rough. Nurses, you have to be very cautious. Do your research. There's no one pushing you to join these big companies that are not providing you with the resources. Check the reviews. Go in and speak to other nurses. Let these nurses give you the true review of these facilities, because guess what? Your license depends on it, and no one, absolutely no one, is going to protect you when it goes to the court. You see, the patient died, and the young nurse, initially they did not take her license. They sent her through remedial, but even through remedial, they still decided, after reevaluating her, they thought that she was still practicing unsafely. She was not ready, which I still feel like it was too hard. She's a young nurse. She just got out of training. You see, when I moved to America, the hospital where I worked, I was a seasoned nurse by then, but the hospital that I worked, I saw how they took care of their young nurses. They ensured that they went into a nurse residency program, and it's a long program. They carry them through a program where they help them. Find you one of those hospitals, preferably a magnet hospital where they have top class nurses and they have the resources to help you. Some of these hospitals, they are practicing unsafely. You won't know that they're practicing unsafely until something happens and you have to go to the board. And the board will not care. The board does not care if you get your license today, yesterday, tomorrow. They don't care. The moment you make a mistake, they will revoke your license, and that's the end of it. When I say you need to protect your license with everything that you have, you need to do that. Don't go to school for 3-4 years, get your degree, and just carelessly, recklessly let these companies trample all over it. At the end of the day, they are going to do what they need to do to protect themselves. But your license, they will not protect. I find that some nurses, they practice in such a way where they have their charge nurse or their nurse leaders keep pushing them to do things. No, that's your license. It is your license. You don't allow them to tell you, you know what? You do this. No, it is your license to protect. They are there to be resource people. They are there to protect you. But at the end of the day, it is your license. Sometimes they don't even know themselves. Sometimes they are just going by certain things. Make sure that you are asking questions, you're verifying, and make sure that you're following protocol and standards, because it's just heartbreaking. It's really heartbreaking when I see or I hear young nurses you just got out of school, and just simple things like these cause you to lose your license. All because of what? All because of what? So I want to empower you, just keep telling you, focus on what is right. You're supposed to witness a medication with someone. Even if you're dragged into a room, make sure you stay there with them and you do it. I don't think that a nurse that just leaves school for 2 months, you should drag them in any room to witness any medication, because sometimes, you see, I saw a post the other day on Instagram where they said that calculation does not matter. Learning calculation will not help. You don't need it. You've never used it. I know as a nurse in Jamaica, because we don't have those pumps that will calculate the drip factor and everything, I had to calculate that drip factor for myself. And I said this to say, if you get, some of the facility will provide you with the safety measures. They will provide you with the pump that collaborate or communicate with the pump. But if you bypass those safety measures and you go tick, tick, tick in that system all by yourself, you are on your own. You will essentially get into trouble, because they give you all the safety things, the things that are supposed to keep you safe. And when you go out there and you practice unsafely, it is going to mess with you. It is going to be your, when I read that news today, it was so stressful. I could not believe these young nurses, they just left school, they just graduated school, and to lose their license, it is really tough. Nurses, and use, as I said in my other videos, find you a big sister, find you a big brother. When you're on a shift, find you a nurse that can support you, that can help you. We all need someone that will help us. Don't go out there on a limb by yourself. You need support. Sometimes when you find some nurse get defensive when you're actually trying to support them. They feel like, oh, I'm a nurse now, I don't need you to be following me all the time, or I don't need you. Listen up. I have had those situations where I'm precepting a nurse, and she feel offended because I am following her through and through. And I have to say, hey, I have no question that you're a good nurse, but it is both of us, our license, that are on the line. I want to make sure that I am doing my part, and you are doing your part safely. But if you just do everything on your own without asking questions, let me tell you, when that time comes and you're called before the courts or you're called before the board, culturally, my culture, your house in a fire. You have to pay for it. So I am telling you guys, ask for help. Ask for help if you need it. Use up the resources that they provide you, and don't just do things on your own, because when time comes and they call you before the board, they're going to snatch your license so fast. And then you're going to be like, what if? There's nothing, there's no link to help you get out of that stress. If you feel like you have not gotten enough support, or you have not gotten enough training for your orientation, request more. They should provide you with enough orientation so that you feel solid enough to start your training. If you don't feel comfortable enough, make sure, and don't just tell them, put it in writing, because that is the only thing that will save you. Young nurses, take heed, listen to me. Protect your license at all costs. Protect it, because when the day comes, you are going to be on your own. You're going to be on your own. Nobody is going to protect you. Nobody. So do the right thing. Do the right thing. Protect your license. Find you a big brother or a big sister. Don't just jump and do things because. And don't do everything that everyone is doing. Don't try to fit in. You hear me tell you? Don't try to fit in with everyone else. Let them talk about you, because I know some unit people, they create a hostile environment by they click up, they have their little clique and they'll discuss you. Don't listen to the back talk. Just stay focused and do what you know is right. Do what you know is right, because at the end of the day, I'm telling you, you don't want to go through school. Do your research for a lot of these hospitals, because after they give you 2 weeks or 3 weeks orientation, that is what some of them giving you. Guess what? You're on your own. They will deem you competent enough to carry out the care, and it's all you at the end of the day. It will be you and your license out there. You hear me? So make sure that you're asking for the help. Do your research with some of the hospitals. Go and look at the reviews and see what it is like working with this facility. What other nurses are saying, what the patients are saying about this facility. And if you feel like you can go there and you can be a change agent, or you can do differently, make sure. And just protect your license, nurses. Please protect your license, because when it comes down to it, it's going to be your words against all of them, and you're going to be in all the problem. Don't let it happen to you. Don't let it happen to you, because when it happens to you, all you can say is, if I did know. But if I didn't know, it already gone. And it already gone, nothing more you can do. Nothing more. Nothing more. So make sure you do what needs to be done and protect your license. I am so sorry for these 2 young nurses. One is 19 months out of school, and the other one just 2 months. And they both is now, they can only say, I was a registered nurse. They cannot practice. There's no appeal, nothing. And I don't know what is the legal ramification for them if they will be charged with the patient's murder. So, nurses, do the right thing. Protect your license. Please comment, like, and share this video. Please let me know what is your take on it. Go and read the article. I think the hospital's name is Mulberry in Connecticut. Go and read the article. Keep up to date with things that are happening in nursing. It will feel scary, but it won't harm you. Just to know. Once you stay in the know, you will know what not mistake to make. Okay, all the best. Take care, walk good, and we'll catch up on next time on the next video. Stay blessed.